All right, let's talk about one of the most incredible and honestly most underappreciated parts of your entire body, the hip joint. I mean, this thing is the absolute powerhouse behind pretty much every single move you make. So, let's dive in. Seriously, just think about it for a second. The moment you swing your legs out of bed in the morning, walking to the kitchen, sitting down at your desk, going for a jog, it's your hips that are doing all the heavy lifting. For a joint that's in almost constant motion, its design is, well, it's nothing short of amazing. So, what is it that makes the hip such a masterpiece of motion? Well, it really comes down to this incredible piece of natural engineering. It's designed for both rock-solid stability and an absolutely fantastic range of movement. Let's break down exactly how it pulls that off. Okay, so the core concept, the real secret sauce, is the ball and socket joint. It's a beautifully simple and, wow, incredibly effective design. You've got the ball at the very top of your thigh bone, and it fits perfectly into this cup-like socket in your pelvis. And that is what gives you the freedom to move your leg forward, backward, out to the side. You can even rotate it in a full circle. So that's the big picture design, right? But to really get it, to appreciate how amazing it is, we got to look a little closer. We need to explore the key components inside that are all working together to make every single movement feel smooth and totally painless. Think of it like a team of all-stars. It all starts with the bones, of course. The femoral head, that's the ball, and the acetabulum, which is the socket. Now, to keep those bones from grinding on each other, they're both covered with this super slick protective cushion called articular cartilage. Then you have these really strong ligaments that wrap around the joint like tough stabilizing bands, holding everything securely in place. The whole system is bathed in synovial fluid. It's basically our body's own natural engine oil, keeping everything lubricated. And finally, you've got the surrounding muscles and tendons, which, you guessed it, provide all the power to make it move. For years, sometimes decades, this whole system can work absolutely perfectly, like a dream. But over time, or because of certain conditions, things can start to go wrong. And that's when the joint starts to, well, send us signals. Pain, stiffness. It's like a cry for help. Now, two of the most common culprits behind that pain are different types of arthritis. And it's really important to know the difference. You've got osteoarthritis, which is what we call the wear and tear type. That slick cartilage we were just talking about, it just gradually wears down from age or overuse. And that leads to painful bone-on-bone rubbing. Rheumatoid arthritis, on the other hand, is totally different. It's an autoimmune issue. It's when your body's own defense system gets confused and actually attacks the lining of your joint, causing all this inflammation and damage. But hey, it's not just about arthritis. There are a few other troublemakers that can pop up. Avascular necrosis is basically like a power outage to the bone. The blood supply to the ball part of the joint gets cut off, and the bone tissue starts to die. Ouch. Then you have things like bursitis and tendinitis, which are inflammatory issues. They affect either the joint's little fluid-filled cushions or the tendons, usually because of overuse. And of course, there are fractures, when the hip bone itself breaks, which often happens after a fall, especially if bones are already a bit weaker. Okay, I know. Hearing about all those potential problems might sound a little daunting. But here's the really good news. For almost every single one of these issues, there is a clear, well-established path to relief. You absolutely do not have to just grit your teeth and live with the pain. Treatment almost always follows this really logical, step-by-step path. The whole idea is to start with the simplest, least invasive options first. You only move up to more intensive treatments if you really need to. Think of it like a ladder of care. And the truth is, most people find the relief they need on the very first few rungs. So this first phase is all about managing things without surgery. It can start with super simple home care, rest, ice, maybe managing your weight to take some stress off the joint. Medications like basic pain relievers or even targeted steroid shots can help tackle inflammation. Physical therapy is huge. It helps strengthen all those muscles that support the hip. And even something as simple as using a cane can take a massive amount of pressure off that painful joint with every step you take. But what happens when the damage is just too severe? Especially with advanced arthritis or that avascular necrosis we talked about. Sometimes those conservative steps just aren't enough. And when your quality of life is really on the line,
Well, that's when surgery can offer a really powerful, definitive solution. Generally, there are two main surgical routes. First, there's arthroscopy. It's minimally invasive. Surgeons use a tiny camera to go right inside the joint and clean up minor issues, like a small cartilage tear. Think of it like a quick tune-up. But for a joint that's really severely damaged, a total hip replacement is the gold standard. It's an incredibly successful surgery where they replace the damaged ball and socket with a new, durable, artificial joint. And that can effectively wipe out the pain and give you your motion back. It's a real game changer. So after going through all of this, how the hip works, what can go wrong, and how we fix it, what's the single most important thing to take away? Honestly, it all comes down to one thing: listening. Really listening to what your body is trying to tell you. You know, persistent pain is not a sign of toughness. It's a signal. It's your body's way of saying, hey, something's wrong here and it needs attention. Just ignoring it, trying to push through it, that's not going to make it go away. The first, most critical step you can take towards feeling better is getting a real diagnosis from a specialist who knows what they're looking for.
Look, your hips have literally carried you through your entire life. So the question I want to leave you with is this. If they're starting to cry out, if they're sending you those pain signals, isn't it time to finally stop, really listen, and get them the help they deserve? Thanks for joining me for this explainer.